Today we'll go over the setup for a stainless steel crown with a therapeutic pulpotomy. To start an SSC, we'll always start the patient on nitrous. So first set up the nitrous nose, and then Dr. Chris will then typically do his injection, which will usually be done with the sewn. And as explained in the other video, we'll just set it up the same way as last time. In every procedure, we should always have all of the suction set up, as well as the air-water tips, as well as the correct size isovac depending on the age of the patient. To start the procedure, Dr. Chris will start by drilling out all of the decay with the two handpieces, high speed and slow speed, with the burrs from the burr block. The therapeutic pulpotomy is being done. Cotton pliers and a plastic instrument will be out. The cotton pliers will be used to transfer the dry and wet cotton pellets to Dr. Chris, and the plastic will be used to transfer the IRM from the capsule to the tooth. The wet cotton pellets will be soaked in formol-cresol. To activate the IRM capsule, the bottom section of this capsule will be twisted until you hear a crack, placed into the shaker, and shook for 10 seconds. Once the IRM is placed, Dr. Chris will then start to call out crown sizes. For instance, if we're working in the upper right quadrant of the mouth, we will go to the upper right section of the case, and for the second molar, he will call out E's, which he calls elephants, and then for the first molars, he will call out D's, which he calls dogs. Once the crown sizes are picked, he will then move on to trying the crowns on. He will first push the crown on, remove it if necessary, crimp it with the box crimpers, as well as size it with the Howe pliers, which look like that. When Dr. Chris is ready to cement, he'll grab the cement capsule, push it all the way down into the table until the green section is inserted all the way. Put it into the shaker and shake for 10 seconds. The cement is shaken. You put it into the cement gun, and there's two different sizes. This is the small one, and that is the size that fits the cement. The crown is full of cement. He will place the crown on the tooth, push it, and wipe it off with the 2x2s, as well as check for any excess cement with the Mirror and Explorer inside this cassette. After the crown has set for a few seconds, he will then go with Gorilla Floss and floss around the crown.